In the last class, we have okay, it's okay. I will say it. In the last class, we have discussed vital signs that works on how to take temperature. Okay, how to take temperature. So today, in physiology practical class, we will study how to take pulse, how to measure pulse. We will discuss about this. Okay, okay. So this is the topic we will be discussing in today's class. Okay. So what is the definition of pulse? It is the rate of heartbeat. Okay, it is the rate of heartbeat. Heart. Okay. So we connect. So here you can feel means your heartbeat. You can feel it. Okay, you can feel it here. So what you will get by assessing this pulse, okay, by assessing this pulse per minute, you will be able to identify your heartbeat. You can even try now. See here, you need to do like this, and you with three finger or two finger also you do, but thumb don't do. Okay, just two finger or three finger, and you touch here. Okay, so here you feel your pulse. I will tell you in the next slide. This pulse is known as what. Okay, so for now you just know that here you can check your pulse, and while checking your pulse you can means through your pulse only you will be able to know your heartbeat. Okay, did you understand? Did you understand this first point? Did you understand or not?
Yes,
Okay.
yes, ma'am. Understand.
Okay.
Yes, ma'am.
Okay. Okay. And what you will get here? This is for the normal purpose. Okay, this is for the normal purpose, but for abnormal. Abnormal means what? Means sometimes the patient or the person will have cardiovascular disease. Okay, for example, high BP, low BP, all this. So for that it will differ. It will be different compared to the normal pulse rate. Okay, so this is it. Okay, okay, are you clear about this? Shall we move to the next slide? Shall we move to the next slide? Response.
Explain the second point.
Hmm?
Ma'am, explain now.
Can you explain the second point?
Second point. Okay. Second point. What does this the normal one? Okay. Normal one pulse rate whatever we are having. But in this second point, what you will get for some patients it will be different. For some patients or for some person means what? Means the person who are having cardiovascular disease. Okay, for example, BP, high BP, high blood pressure, low blood pressure. Okay, who used to get like anxiety, hyper. Means for all this, the heartbeats will be different. Means the pulse will be different. The pulse rate will be different. Okay, did you understand? So this is about the second point. Understand, Sajarika? You are asking me, na? Are you clear, Sajarika? Hmm? Are you clear or not now? So let's move to the next. Okay. So pulse. So pulse, what is the main definition? It is the okay pushing against the wall of the artery as the heart beats and rests. All the function of heart now I'll explain to you in theory class. Okay, in theory class, I will explain to you about this topic. But for now, you just know This pulse means what? The pressure of the blood. The pressure of the blood which is pushing against the wall of the artery. Okay, for now we just remember that. And when this heart beats and rests, the heart pumps and relax again. So that duration or that time is known as the pulse rate. Okay, so this is about the definition. Okay, and where you will find your pulse more easily, I mean, where can you measure your pulse more easily? In your arteries, because they lie close to the skin. Okay, your arteries lies close to the skin. So for that, for assessing the pulse rate, it's easy. Okay, so are you clear about the definition of pulse? You remember that it is the pressure of the blood. Okay, this pulse is the pressure of the blood which is pushing against the wall of the artery. And where can you find the pulse more? Yes, I mean, where can you assess the pulse more? It will be more prominent. It will be more prominent in the artery. Why? Because the artery it lies close to your skin, so for that it will be easy to assess or easy to know the pulse rate. Okay, shall we move to the next slide? Are you clear? Are you all clear? Oh,
Yes, ma'am.
okay, clear. Okay. So this pulse rate, how will you assess? Okay. Number of beats per minute. We have to assess per minute. Okay, means 1 minute. Okay. So this pulse rate again will be different for different people. Okay. Variables means it will be means divided in means what to say. It will be different for every person, every individual. It will be different. For example, age. Means for the adults and for the aged people, no, it won't be same. The pulse rate it won't be same age. Okay, it will be same. And sex means male, female. No, again it will be different. It will be different for the male. It will be different in terms of male and it will be different in terms of female. Sex and body size. Body size means what? Thin and fat people, no? Okay. So, and again, it will be different for the person. Like, for example, if a person is coming, means is walking towards the steps, okay, or else running, and if suddenly you will ask the patient, like, can I check your pulse rate? Means the person is like running, means jogging, or else coming from somewhere, very tired, exhausted. If you will check the pulse rate at the time, it will be different comparing to the normal one. Okay, so in this thing also it varies. Okay, did you understand this one? Did you understand?
Yes.
Listen. Okay.
Yes, ma'am.
Okay, pulse site. Where can you check your pulse site? I mean, where can you feel your pulse? First, let's start from the head to toe. We start from the head. That is temporal. Okay, in the this one anatomy class also I've explained to you in the bones, temporal bones, occipital bones. Do you remember? Do you remember or not? I've already explained.
Ma'am. Yes, ma'am.
Okay. So temporal is here. Okay, here, this part, temporal artery. This is your temporal artery. Okay, you all just check once. Tashi, please turn on your video. Tashi. Okay, then I Street, please turn on your video. I Street Dev Burma. Hi Sri Dev Burma, please start on your go. So you follow me, okay? This is temporal. Which side is the temporal? Don't smile.
Here, ma'am.
Yes, yes. You can feel your pulse here, okay? Can you feel it? Don't laugh. Can you feel
Yes,
it?
ma'am.
That one is your temporal, okay? It's temporal artery. You can feel that. Next is your carotid here. Okay, understand, no? And next is here.
Yes.
Okay, this, this part. Okay, where your thumb side. Oh, sorry. Brachial is here. I'm so sorry. Brachial is here. Okay, and labial is here. Femoral I can't show you because I'm sitting. Femoral here.
Yes, ma'am.
Okay, and popliteal is behind the knee. Okay, this part. Popliteal. And the next is dorsalis pedis. This part. Your pedal means your feet side. Na? This one. Means at the top of your feet or foot. Okay. So these are okay. You can turn off your video. Turn off your video. Okay. So these are the sites for checking pulse. Did you understand? Did you understand? Actually, I forgot to mention the normal range of pulse rate. Okay. Actually, it's 70 to 100. 70 to 100 beats per minute. Normal range. Okay. Normal range of pulse is 70 to 100 beats per minute. Beats means like beats. Because it's beating, no? Your heart is beating. So for that, we need to mention that one. Okay, can you see this?
Yes, ma'am.
So this is the normal range. This is normal pulse range. 70 to 100 beats per minute. Okay. So are you clear? Are you clear, everyone? Starting, starting from the beginning, starting from the very beginning. Pulse. Actually, what is pulse? This is the heart rate. Okay, how many times your heart is beating? Your heart is beating, isn't it? So from your heart is beating and it's connected right to your this artery. What artery? Radial. Okay, from the radial artery or any artery, you can feel your pulse. You can feel your pulse. Actually, it's the number of heartbeats. How many times your heart is beating for each and every minute. So that is about it. Okay, are you clear? Is the rate of the heartbeat. Okay, this pulse is the rate of the heartbeat, like how many times your heart is beating in each and every minute. Okay, okay, but for it will be different for different person. Different person means like what? Like for example, say you are having high BP, low BP, all this it will be different. Okay, so this is about in some type of cardiovascular disease like that. Okay, so it will be different for different people. So pulse is the pressure of the blood. Okay? It is the pressure of the blood. It is pushing against the wall of the artery. I'll explain to you about the function of the heart in your theory class. Okay. So for now, you just know that this pulse is the pressure of the blood pushing against the wall of the artery, and it can be felt in the arteries more. Why? Because it is near to the skin. So that it will be easy. Okay. Okay. And this pulse rate is defined as the number of beats per minute, and it will be different for different individuals. For example, say age of the person, it will be different in case of your father or your mother compared to you. Okay, or the elderly people, it will be different also. And sex means male, female, no, gender, it will be different. It will be different for the male and it will be different for the female. Okay, and terms of body size also it will be different. For healthy person or else fatty or the obese person it will be different. And for the person who are healthy or else thin, it will be different. Okay, and it will vary upon your work. Also, work means like if the person is exhausted or running home like somewhere ran about 1 to 2 meters, if you run and come back, it will be different. The pulse rate will be high uh, compared to the normal pulse rate. So this pulse rate will be okay. Okay, and sites for checking pulse. First is temporal, means carotid, brachial is here, okay, radial, radial is here, femoral, okay, popliteal, behind your knee, dorsalis pedis, at the top of your foot or feet, and the normal range of pulse is 70 to 100 beats per minute. Okay, are you all clear? Are you all clear? Please respond.
Yes, ma'am.
Okay, okay.
Yes, ma'am.
If it is clear, then it's good. Okay, I'll just pick out your names. Okay, whoever I can see the screen. Ayushri Dev Burma, response please. Ayushri Dev Burma, stay present.
Yes, ma'am.
Okay, okay. Mute yourself. Adam,
Yes, ma'am.
okay. Ivan Moon, response. Okay, Ivan, can you hear me, Ivan? Ivan Moon, Ivan Moon. Okay, Aseng Modi, Aseng Modi, response. Quick one.
Present, ma'am.
Okay, Ayang Taku,
Yes, ma'am.
okay. Bandrilin, Bandrilin,
Yes, ma'am.
okay. Damjum,
Yes, ma'am.
okay. Dynasty,
Yes, ma'am.
okay. Ivadora,
Yes, ma'am.
okay. Gorda, Gordas,
Yes, ma'am.
okay. Grafo,
Yes, ma'am.
Hasina, Hasina,
Yes, ma'am.
okay. Jonvik, Jondeep.
Yes, ma'am.
Okay.
Yes, ma'am.
Okay.
Present.
Kajal Kumari.
Yes, ma'am.
Kezia. Kezia. Kezia.
Yes, ma'am.
Okay. Kintu. Kintu. Kintu.
Yes, ma'am.
Okay. Marbut Mule.
Yes, ma'am.
Okay. Mari Debarma. Mari Debarma. No response. Mercy. Mercy.
Yes, ma'am.
Okay. Nasmin. Nasmin. Response. Okay. Miracle.
Yes, ma'am.
Mochong. Mochong. Nakishisha.
Ma'am.
Okay. Praki.
Present, ma'am.
Rajwal. Rajwal.
Yes, ma'am.
Rani.
Yes, ma'am.
Roop Jyoti.
Present, ma'am.
Sakshi. Sakshi. I have. Time table. Simon. Simon.
Present.
I can hear your sneezing sound, coughing sound, but not your voice. Okay, Sajarika. Sakati.
Yes, ma'am.
Salmi. Salmi.
Yes, ma'am.
Shanti. Shanti.
Yes, ma'am.
Sujana. Sujana.
Yes, ma'am.
Subhash.
Yes, ma'am.
Anya.
Yes, ma'am.
Yakar. Tabayakar. Please,
Present, ma'am.
please respond. Takyo Mete. Takyo Mete.
Present, ma'am.
Tao Yati. Tao Yati. Okay, I saw Tao. Okay, Tao Yati. Tashi Somu.
Yes, ma'am.
Okay, Tenia Montes.
Yes, ma'am.
Okay. Tulunga Nursery.
Yes, ma'am.
One Bihun. Bihun. One Bihun. Okay. Yatu.
Yes, ma'am.
Two.
Yes, ma'am.
Okay. The total number of students I got 45. Okay.
Hello, ma'am.
Huh.
Hello?
Yes, yes, Nesmin.
Ma'am, it's me, ma'am.
I know, Nesmin. I already marked it. Okay.
Okay, ma'am, thank you.
Mm-hmm. Okay, so today 45 of you are present. Okay. Okay, thank you. That's all for today's class.
Ma'am.
Hmm.
Thank you, ma'am.
Yes.
Thank you, ma'am.
You can leave the meeting.